gets to two of the big criteria. The helping a physician or another patient could select information and then send it on. So this is another form of curation, essentially, where a patient is able to, a patient can receive, a beginner especially, newly diagnosed, can receive just information, and then at the end, that search was among, so for instance, I think you picked Mayo Clinic and LLM and a few other reputable sources, and the search then was within the links from those sources, so you don't really go off and find anything else. So that's a pretty interesting way of doing it. You also raised a question, which I'm now going to start with the whole group, because if we're going to talk about Health 2.0 in Europe, and Denise raised this question, it was in the first question we talked about earlier, the issue between how do we pay for this stuff, what's the business model, who's providing this, and there's like a variety of different opinions and business models on the sitting on the couch. So let's get into this. Wes, you've kind of mentioned you were a software and ad supported model. Can we just do a 15 seconds down the road, how do you support your service? You should go on.
Yeah, we've got multiple revenue streams. Advertising obviously is a big driver. Licensing for those non-advertising partners. We also have to do per member per month. So for us, it's really adopting our business model to reflect how the partner makes money or how they're most used to executing the business.
So it's a combination between media partners and then if there's an American commercial health plan that pays per month. Yeah, per member per month. You can.
Right. If we were to do the government of France, for instance, we would do a licensing agreement.
Right. Exactly. So Frankie.
Medworm's in its early days yet, but it does have a business model that I'm working towards. I believe very strongly that the data in Medworm must remain free. I've collected it freely from publishers, and it must remain free to be distributed as widely as possible. So on the back of that, various revenue options are through advertising, sponsorship of feeds, and also potentially sale of statistical analysis on who's actually reading what via Medworm, because that data is becoming quite sizable now. All what is read actually on the site and also in the feeds that are subscribed to starts to give quite good intelligence, which could potentially be monetised in the future.
So then, how does Orphanet, in a term like Orphanet, you assume it's support orphans, so it needs no money.
We are not often. We are totally funded through public funding, so it's coming from the European Commission, but also from all countries in Europe. Because the health authorities believe that by providing accurate information and indicating where are the expert services, this will improve the healthcare system and this will also help the patient to be better treated. So it's a very European approach. We have also some private sponsors, mainly private companies, pharmaceutical companies and biotech, because they are also interested in offering good information on these diseases for which they have a product. And we have some revenues through the sale of our data for consultants of pharmaceutical companies doing data mining and things like that, but that's really marginal compared to the public funding.
So how does a